My name is David Smith. This is the Pediatric Head-to-Toe Assessment, University of Memphis Nurse Practitioner. Scan the room. Scan the ceiling. Scan the floor. All right, I have sanitized my hands and I have identified my patient. All the skin interview or all the skin assessments will include color, temp, turgor, texture, moisture, edema, scars, bruising, lesions, and nevi. We'll start with the head. It's symmetrical and normal cephalic. It's midline. Then we'll look for the hair, normal hair distribution, texture, and color. We're going to palpate for tenderness, lesions, depression, infestation. And then we'll palpate the temporal arteries for tenderness. And then we'll go to the lymph nodes, preauricular, postauricular, occipital, submandibular, submental, post-cervical, anterior cervical, and subclavicular, supraclavicular. And then we'll check the jaw. All right, open your mouth. Move it side to side. Does that hurt?
On this side.
Okay. Now clench your jaws. Her cranial nerve number 5 is intact. All right, close your eyes. And tell me where I'm touching.
My forehead, my chin, my nose, my cheek, my teeth.
All right. Smile, frown, puff out your cheeks, pucker your lips, raise your eyebrows. Her cranial nerve 7 is intact. So now we'll move on to the ears. They're symmetrical, they're in line with the eyebrows. We'll check for tenderness, lesions. Then we'll check the internal ear. And the auditory canal, the tympanic membrane is pearly gray with no bulging, and the cone of light is at 7 o'clock. And we'll do the same thing over here. The auditory canal is clear. The tympanic membrane is pearly gray and no bulging. And the cone of light is 5 o'clock. Now cover up this ear. And I'm going to whisper, and you tell me what I'm whispering.
1, 2, 3.
All right, cover up this ear. I'm going to whisper. Tell me what I'm saying.
ABC.
Now we'll do the Weber test. I want to make sure that you can hear equally on both sides. So let me know if you can hear on both sides.
Yes.
And then we'll do the Renee test. Let me know when you can't hear it anymore.
No.
Let me know when you can't hear it anymore.
No.
Same thing on this side.
No. No.
Her air conduction is longer than her bone conduction. And then we'll move on to her eyes. We'll look at her lashes, her eyebrows. We'll look at the symmetry. We're going to look at any discharge. We're going to look at her conjunctiva, see if there's any discoloration. Her sclera is white. So now I want you to cover up one eye and read the bottom, the lowest number, the smallest one you read.
L-T-E.
Okay, now cover up the other one, uncover that one, and read the lowest one.
L-T-E-P-A.
Okay. Now with both eyes open, read the smallest one.
L-T-E-P-A.
Cranial nerve 2 is intact. Now we're going to look at her pupils. All right, just look straight at my nose. Her pupils are a 3 right now. They are equal roundly active. And now that was direct, we'll do consensual. Now, Hadley, find a spot on the wall and look at it. Over here, straight ahead. All right, now I want you to follow my pen to your nose, okay? Now look at my pen, follow it all the way to your nose. Good. Accommodation and convergence is normal. Now I want you just to follow this with your eyes, don't move your head. The 6 cardinal fields are normal. Cranial nerve 3, 4, and 6 are intact. Now we'll look for the red reflex. Look straight ahead. There. And now we will look at the internal structures. The artery, the vein, and the disc are normal. Same with that eye. Now the nose, it's midline, it's straight. Do you have any tenderness there? Does that hurt?
No.
Okay. All right, close your eyes. Tell me what you smell.
Strawberry.
And now we'll move on to the throat. We're going to look at lips, teeth, gums, tongue, under the tongue, the soft palate, the tonsils, the salivary glands, and the buccal mucosa. Open your mouth. Say ah. Her uvula and her soft palate elevated, so cranial nerve number 3 is intact. Stick out your tongue. Go side to side with it. Good. Cranial nerve 6 is intact with no fasciculations. All right, we'll move to the throat. Trachea is midline. Check for a carotid pulse. All right, now we're going to listen. All right, Hadley, hold your breath. Okay, you can breathe. Now hold your breath one more time. Good. All right, now we're going to move to the back. And we are looking for any signs and symptoms of respiratory distress like tachypnea, nasal flaring, cyanosis, tripod positioning, use of accessory muscles and retractions. We're looking for any injuries, deformities, and symmetrical. Take a deep breath. She had good symmetrical chest rise. And now we're going to do tactile thermitis. All right, Hadley, every time I move my hands, you say 99.
99, 99, 99, 99.
Good. And now we'll percuss.
It's like a percussive.
And now we will listen. Just breathe. And now we'll check brachiopathy. This time I want you to say E every time you feel the stethoscope move.
E. 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 E.
Now bronchophony, I want you to say 99 every time you feel it move. Now.
99, 99, 99, 99, 99, 99, 99, 99,
Okay.
99.
And now I want you to whisper 1, 2, 3 every time you feel it move. Good. All right. So now we're going to look at the front of the chest. We're looking again for any signs of respiratory distress. And we'll do tactile thermitis again. Every time I move, say 99.
99, 99, 99.
Now we're going to listen. Now we'll come and lay on the bed. We'll set up just a little bit. Right here. Now we're going to listen to her heart tones, starting with the aortic valve, second intercostal space, right sternal border, pulmonic, second intercostal space, left sternal border, Erb's point, third intercostal, tricuspid, fourth intercostal, mitral, fifth intercostal, midclavicular. And then we'll listen with the bell, aortic, pulmonic, Erb's, tricuspid, mitral. And we'll listen for, feel for the maximal impulse, and then we'll listen for 1 minute to get her apical pulse for rate and rhythm. And then we will move to her stomach, and we're looking at her stomach for the contour and symmetry. Then we'll listen to the abdominal arteries, her aorta, renal arteries, iliac arteries, her femoral arteries. And now we'll listen to vowel sounds in each quadrant. And now we'll percuss each quadrant. And light palpation, looking for tenderness or mass. And then deep palpation. Okay. Now we will raise up, check for CVA tenderness, none noted. All right. Now we're going to lay at a 35-degree angle. We'll look for JVD. We're going to look for pulsations, heaves and lifts, none noted. We're going to palpate the aortic, pulmonic, Erb's, tricuspid, and mitral. No thrills noted. Now we're going to listen. Atrial, pulmonic, Erb's, tricuspid, mitral. And then with the bell, aortic, pulmonic, Erb's, tricuspid, mitral. Okay. Now we'll move on to the musculoskeletal. All right, you can sit up. All right, come back up your stool. And we're going to be looking at, we'll start with the upper extremities, looking at the joints for tenderness, swelling, edema, deformity, crepitus, asymmetry. We'll start with the fingers. Did any of that hurt? Capillary refill is less than 3 seconds. Her pulses are strong. Squeeze my fingers. She's 5'5" with grip. Okay. Do your elbows hurt? Okay. So I want you to put it up here. Push against my arm. Push this way. Okay, good. And pull. Good. Same thing with this one. Push. Good. Pull. There you go. All right. Any pain in your shoulders?
No.
Okay. Shrug your shoulders up. Good. Cranial nerve 11 is intact. Now push your elbows out. Good. Pull them in. Good. All right. Now we're going to do some range of motion. Adjust the camera a little bit. All right. Fingers like this. And open them. Open them wide. Okay. Spread your fingers out. Abduction, adduction, and finger to thumb opposition. Good. Now your wrist, flex, extend, hyperextend. radial arm rotation. Okay. Elbows flex, extend, hyperextend. Shoulders, abduction, adduction, internal rotation and external rotation. Switch and rotation. Good. Now I want you to close your eyes, and we're going to check her cerebellar coordination. Hold your hand open and tell me what I'm putting in your hand. Don't look at it. Close your eyes.
I don't know, but it's like some kind of coin.
Okay, a coin. All right, this one. Close your eyes.
Key.
A key. Now we're going to draw in your hand. You tell me what number I'm drawing. Close your eyes.
See?
Okay. And over here.
30.
Good job.
See 30.
Now you let me know where I'm touching.
My arm.
Close your eyes.
My other arm. My wrist. My wrist. My knee. Middle of my knee. Foot.
Good. Now we're going to check your vibratory sensation. Can you feel this?
Wow.
Can you feel that?
Yeah.
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 And we're going to check reflexes, the brachioradialis, the bicep, and the tricep. And over here, brachioradialis, bicep, and tricep. Patellar, okay, Achilles, and Babinski.
That tickles.
All right, now we're going to move to the lower extremities. All right, have a seat. Starting with the toes. Does any of that hurt?
No.
Okay. Capillary refills, less than 3 seconds. Dorsalis pedis pulse. Posterior tibial pulse present on both sides. Any pain in your ankles?
No.
All right, push against my hand. Good. Pull. Good. Any pain in your knee?
No.
Okay. Push against my hand. Good. Now pull against my hand. Good. Push against my hand. Good. Pull against my hand. Good. Any pain in your hips?
Oh, this one has been hurting.
Okay. Push against my hands with your legs. Very good. Pull. Good. All right. So now we're going to do some range of motion. With your toes. With your toes, curl them under. Put them up. And way up. Okay. And your ankle. Down. Up. Inside. Outside. Rotate. Good. Your knee. Flex. Extend. Hyperextend. Same thing with this one. Flex. Extend. Hyperextend. Good. Now we'll stand up. And
Ow.
with your hip, we're going to flex, extend, hyperextend. Okay. All right. With the other one, same thing. Flex, extend, hyperextend. Okay. Now we're going to take it away. Abduction, adduction. Okay, good. And now internal rotation, external rotation. There you go. Internal rotation, external rotation, and circumduction, Good. Circumduction. Good. Now we're going to look at your back. Bend over just a little bit. We're looking at the spine, checking for any tenderness, any deformity, any of that hurt.
No.
Okay. So now we're going to bend over, hyperextend, or flex, extend, hyperextend. Good. Now, lateral, other lateral. Good. Rotation. Just your hips. There you go. Good. All right, now your head. Any tenderness, any pain there?
No.
Okay. Chin down. Chin way up, and then way up. All right. And then take this ear to this shoulder. Good. This one to that. And now rotate it. Good. Now, I want you to close your eyes and hold your arms out like this. Good. Now, I want you to walk that way, just normally. Okay, good. Now turn around, come back, and walk heel to toe all the way back. Good. All right. Now, I want you to turn around and hop on one foot. All right, back over here. We're going to hop in place. Come here. Hop in place right there on one foot. All right, now the other foot. Good. And that ends our assessment.